it's important that appropriate treatment be available, and that's not available for everyone in our country today. I think it's not often affordable, it's not often fully covered by health insurance, and so that's a huge issue. The other piece, I think, is education. Not so much to prevent addiction in ourselves, although that certainly is part of it, but as professional educating ourselves about what addiction looks like in the general public as well as in our profession. There are so many resources out there to help us as nurses and other health professionals learn about addiction, to learn what the signs and symptoms are, to learn what we should do if we have concerns about a colleague. The one thing I can say that's probably the most important thing to do is don't do nothing. At the very least, if you have concerns about a colleague, you need to consult with someone who's more knowledgeable and get some direction about what you can do. That would be helpful.
Well, I think hospitals and medical schools and healthcare organizations are certainly aware that physicians can be impaired. And if somebody is not doing well, at our medical school there's a physician wellness program, and people can be referred there by their supervisors, by colleagues. They can be self-referred, and then they can be usually at that point they're ready to get help. And if they aren't functioning, or if they're doing something that shows poor judgment, for example, drinking heavily on an on-call night, then they have to be removed from a practice setting and go into treatment. The state licensing agencies are pretty open-minded about that. They treat alcoholism or drug addiction as a treatable illness. And so if an impaired physician is forced to go into treatment, and sometimes it's a great relief to them, other times they go kicking and screaming. But if they stay in treatment, and if they comply with drug testing programs, then they undergo a period of probation, and then they can regain full licensing. I know physicians who actually are back in full-time practice and have all prescribing privileges. They're allowed to prescribe controlled substances. So I think the licensing agencies and the profession has a pretty open mind about it. The legal, sometimes impaired physicians break the law. They falsify information on prescriptions, or they even steal medication from patients. So they face both the criminal justice system as well as the licensing process. And the criminal justice system in Virginia also tries to offer opportunities at rehab before punishing people. So again, the few instances of physicians I know who have had to go before a judge, they've been offered probation and a chance to keep their legal record clean.